and this is the first series of the lecture tutorials that I'd like to do on my channel. So if you do like my videos and if you've seen the other explanations and stuff, please leave a like as well as hit the subscribe button, and please share the video with all your friends and family, and whoever's interested in learning, doing medicine, doing dentistry, doing biomed, all these students who like to learn a bit more about the human body and get a much more detailed. So today's topic, we're going to covering the skull, the top part of the human body, the upper limb, and we're going to start off with the skull's anatomy today. And so on the left here I have the 3D model. This is basically an app that I downloaded off the App Store on my Mac, and on the right I have a detailed labeled diagram of a lateral aspect of the skull as well as an anterior view, so you do get an idea of what I talk about when I click on these things. So in case I don't explain everything, you can always refer back to these pictures, and if sometimes my accent might not be the greatest, so if you don't understand, you can always refer back to these pictures and then get an idea of what I'm talking about. Right, so this is the skull. Now the main part of the skull, the top part, where your forehead is, it's referred to the frontal part, so it's simply known as the frontal bone here. So you can see it's written as the frontal bone, and here you can see that it's called the frontal bone. Now over here, if I was to highlight it with a pen, what you have here is supraorbital foramen, this bit here. Now this is not always shown in the 3D diagram, so it doesn't come up, but here you can see on this diagram here, this is known as a supraorbital foramen, or the notch. Now foramen is basically simply referred to as an hole through which nerves and everything passes through, or your blood vessels and things that innervate the skull passes through. So now what we have is the nasal bone. So we've got, imagine this is the right nasal and this is the left nasal bone. Now what we have is, so we have the frontal bone here, we have the nasal, right and left, then we have what's known as this middle bit here near your nose and here. This is known as the maxilla left. So you can see here, this is known as the maxilla, and on this side we have the right maxilla. So there's basically a mirror image of whatever you have on the left here is the same thing that we have on the right. All we do is we just call it right and left and the appropriate Greek name that's given to the parts of the body. Now the bottom part here, the jaw, that we refer to in normal common language is known as the mandible. The mandible has different areas, which I'll go into a bit more detail. But this is known as the mandible. So you can see here the mandible. The mandible also has foramens, and this is known as the mental foramen right here, the hole here. You can see it's written, labeled here. And this area here, which is almost as if like certain people, once they grow up, they refer to this as they have a bum chin or a butt chin. You can see in some people, and this is due to the mandibular symphysis and how that grows, and that's determined genetically. So if you have a bump, or you don't have a really flat part here, certain people end up having a bum chin. That's what you refer it to as. So you have like two little things. If you ever watched Family Guy, you know Peter Griffin has a bum chin. Yes, that's an example. So going back, we have frontal here, we have the maxilla here, the right here and the left. Then we have the mandible, which is also referred to as the jaw. Now to the side, this whole area here, it's referred to as the orbit, the eye canal, or the hole which your eye is placed in is known as the eye canal. And just above the orbit, where your eyebrows are known as the supraorbital margin. So you can see here the supraorbital margin is labeled on this diagram here on the right. Now the main part you want to look forward is the suture here, right? This suture here, which is labeled on this diagram here, it's known as the Frontonasal Suture. So that's simply the frontal bone is at the top part here, and this is the nasal part. So therefore, all you do is combine them together to form the Frontonasal Suture. And suture is simply areas or places where two bones meet each other, or maybe more than two bones. An example of that is the pterion, which we'll come on to later. Now, so this part here is called the Supra orbital foramen, which is this hole here, and you have the supraorbital margin. Now you have the glabella, what we refer to as this bit here. Now, if you ever feel your forehead just above your nose, you can feel a little bump, and shown in this image here, and that's known as the glabella. And certain people, that bump is more prominent than the others, and it really depends all down to genetics and how bone ossification and how this whole process takes place. Now on the side here, what we have is what's known as the zygomatic bone. So that's this here. So we have the left zygomat, and also on the right we have the right zygomatic bone here. So the right is here and the left is here. Now you can see that there's a, if I was to just rotate this up slightly, you can see that there's two holes present there, and that's referred to as the infraorbital foramen. So infraorbital foramen right and infraorbital foramen left. So simply, the whole purpose of all of this is to supply it. This is the hole through which your nerves and your blood vessels that innervate your face. So for example, your facial nerve, your trigeminal nerve, and so on. These are the holes that they will pass through. So from looking at this video, so hopefully you have a basic idea of the front part of your bones. So there's the frontal, nasal, left and right. You got your glabella here. You got your supraorbital margin, supraorbital arch. You have your supraorbital foramen. You have your zygomatic bone. You have your maxilla left and right. You have your infraorbital foramen. You have your mandible, which is your jaw. And you have your mental foramen both on either side, and then what we have here, some people who have butt chins have mandibular symphysis. So now we're going to focus on the nose, and this part here, just below the nasal bone, is known as the vomer. This is the bone that's inside the so if I was to isolate that by itself and hide others, so this is what it looks like. Simply, this bone looks like this on a lateral scale. So there's the vomer. Now if I was to bring the others back and fade the others, so this is what it looks like, the vomer, and it extends all the way in. Now just above the roof of the vomer we have the ethmoid bone, and if I was to fade the others, you can see the ethmoid bone goes across like that. So that's the ethmoid bone here, highlighted in green, and what we have on the bottom, it's the vomer. Now if I was to come back to this image here, in an anterior view, you can see that this little blue thing is known as the vomer, and here we have the perpendicular ethmoid bone. The ethmoid bone is consisted, to be more precise, the ethmoid bone consists of two parts. So if I was to, this is the image that you see right here. So you have the perpendicular plate, which is the middle bit, which my mouse is pointing to, and the end bit, it's the two end bits that my mouse is pointing to now, left and right. It's known as the mid-nasal concha, or concha, you could say. And basically, both of these together forms the whole ethmoid bone. So on this right-hand side here, you can see the mid-nasal concha and the perpendicular ethmoidal plate together forms the ethmoid bone. On the bottom part here, it's known as the vomer, and it extends all the way in. Right, now, so that's two things. Now what you want to, a key aspect, what you want to know is what you want to know is that when these skulls, or when you have the nose, your nose is made up of you have cartilage around here. So there's the bones of your nose, or your nasal cavity, you can say. And so the main ones that you need to be aware of is your nasal bone, then you got your perpendicular plate, your nasal concave. These two together make the ethmoid bone. Then you have your vomer, which is here. Now, what you have, if I was to turn it laterally, so if we go back now, so this is your maxilla, and now here what we have, it's known as the lacrimal bone, the lacrimal bone, right? And you have that similarly on this side as well. So if I was to hide the rest, you can see that the lacrimal bone is a small bone, and it's the smallest bone in your body, to be precise. Now what you have here is the ethmoid bone, and that's part of the ethmoid bone that we saw earlier. So you have your lacrimal first, just behind is the ethmoid, and here is the part of the maxilla that forms together. So your orbit, the bottom surface of your orbit is formed from the maxilla, your lacrimal bone, and part of your ethmoidal bone as well. Now the middle thing, the greatest part of your skull, which is not really shown, is known as the sphenoid bone. It's like a dragon's wing. It's got a butterfly wing shape, and you can see this is very complex. So if I was to hide the rest of the part of the body, you can see the anatomy of the sphenoid bone, which runs right through the middle of your skull to either side. And here you have many different types of foramen, which I'll go into detail in a bit later. So your sphenoid goes from one end, so it forms this part here of the skull, and it forms this part here as well. So your sphenoid is the bone that runs through the middle. So if I was to like fade the others, so you can see from the bottom as well, that's the sphenoid. So it forms the major, really important, it forms the major middle part of your bone. Right, now if I was to switch this to the lateral aspect of your bone, so if I was to go for a quick recap, we have the mandible bone here. Now if I was to click there, and you have different part of the mandible bone. So what we have here is the anterior part. So if I was to bring this slide here, so here we have the anterior part, here's the lateral part, and here's the posterior, and here's the lateral again. Now if I bring this back, that's the mandible. And if I was to click on the maxilla and isolate again, we have similar thing. Here's the anterior part of the maxilla, medial, posterior, so when we look from the back of the head, and here's the lateral, so when we look from the side. So it's a very complex bone, as you can see. It looks different from all different angles. So this is the part that forms your jaw. This is just above your teeth, so you can see this is where the molars and your canines and all your teeth sit. Right, so now here is a zygomatic bone, and here's a zygomatic arch. So what we have here is the temporal bone, and the temporal bone connects onto the zygomatic bone via this green bit here, which is not highlighted in this 3D anatomy. It's known as the zygomatic process of the temporal bone, or the zygomatic arch. And you can see that here on the right hand side on the skull lateral aspect diagram, which is shown here. This main bone here is known as a temporal bone, and it's just found just above your ear. And you have your mastoid process, which is the bump. If you can feel the back of your ear, but just behind your ear you feel a bump, and that's this bit here known as the mastoid process. Now this bit is part of the parietal bone, and the back here is known as the occipital bone. Now this here is the ear canal, or you can know as the external acoustic meatus. which you can see here on the right, and you have a little thing protrudence which comes off it, which is known as the mandibular styloid process. Sorry. So if I was to go down that way, you can see that this pointy bit. So if I fade the others, this pointy bit here is known as the styloid process. And this is the external acoustic meatus. So this is where your ear canal, your earwax and everything builds up. So what you see through your ear, and the bumpy part just behind it, it's known as the this bit here, which is the bumpy part that you feel behind the back of your ear, is known as the mastoid process. Now you can see that this here, it's part of the sphenoid. There's the temporal bone right, and here is the parietal. Here is the zygomatic bone, which is linked to the temporal bone via the zygomatic arch. Now there's different views, or different, you can isolate this and you can find out that the zygomatic bone has a medial, so it looks posterior and lateral. And doctors and many medical professionals say this is the weak part. So if when you're in a fight, or when you're somehow get into some wrong parts, when people give you a blow to the head or something, usually what happens is these parts are weak spots, and this is where you're most likely to break the suture between the mandible, the zygomatic bone and the zygomatic arch, which links it to the temporal bone, or somewhere here. Now, if we go back to this main part of the head, the top part, what we see here is there's the frontal bone, here's the parietal right, and here's the parietal left. Now, this zigzaggy line here is known as a suture, and I said before, a suture is something that is an area of point where two bones connect to each other, and this is known as the coronal suture, which is shown here on the lateral aspect diagram here. And when babies are initially born, there is a soft weak spot here known as the anterior fontanelle, and this usually takes about 3 to 6 months for it to close up, and they have one here, and they have one at the back of their head, and a few on the sides as well. So if a baby is born and you put your put your finger here in the top part, you can feel that there's a slight hole kind of thing, and that's because the bone ossification process is not fully done, and the whole purpose or the physiology behind that is because it allows the brain to develop more faster, as well as easier passage through the brain birth canal when the baby is when the mother is giving birth to the baby. Now, this line here is known as the coronal suture, and there's another suture that splits between the two sides of the parietal. So you have the parietal right here, and then you have the parietal left here. Now if I was to flip this completely back around, you can see that there's a parietal right and there's a parietal left. Now the backbone is referred to as the occipital, and this is the back part of your head, and this is a very complex process which we'll touch upon in a bit more detail in the next video, I guess. Or I can simply do it now. If I just open up the lateral aspect of the bone, then you can see it much far better. So if I was to go down, minimize this, and open posterior view. Right, just bear with me a second because I have to get this sorted out. So what you see here is the occipital bone, which is shown on the right here, and we have various different types of areas within this occipital bone that you need to be aware of. The first thing is this line here, which I forgot to mention, known as the sagittal suture, and that's only due to the name is given because of the sagittal plane. So what I would advise you to do before you start learning your anatomy in detail, you might want to go over the different types of planes that's present in the body. So you've got the sagittal view, you've got the coronal view, medial, lateral, and so on and so on. The various different. So the main three cranial bones, so you have the occipital here, the parietal here, then in the front you have the frontal bone, and on the side you have the temporal bone, and here is formed from the wings of the sphenoid bone. So this is what forms your cranial, the outer part of your skull. Now what's interesting with the part of the posterior part of the skull is that if you look carefully here, you can see that there's a suture that connects the occipital with the parietal right and parietal left, and this is known as the lamboid suture, which is shown here on the right. And you have here, which is known as a supranuchal line, which is not clearly shown in this 3D view, but if you ever get around to buying a 3D skull, or it's always good to invest in a 3D skull, or you're in an anatomy lab up in whatever medical school or whatever university that you go to, you can always get down there and hold a skull and check the back of it, and what you have is these little bumpy areas, which this first one is known as a superior nuchal. So superior meaning it's on top, and on the bottom part you have the inferior nuchal line. And now here, the bumpy, some people have this little bump at the back here, which you can most likely feel with your fingers. So if you were to palpate around the back of your head, you can feel this little bump which goes down, and this is known as the external occipital protuberance. So it's less like a little bump that you can feel around the back of your head. Now, what many anatomists and what many models of the skull miss out in terms of when they teach you is this blue part here that's highlighted here, which is known as the sutural bones, and that's very key because if you ever become a brain surgeon or you become a neurosurgeon, when you're doing any brain surgery or anything like that, you can find out that when you cut around the head, you get this part as well. And what I find out is when you're in many medical schools as well as many universities, anatomy labs and anatomist students and stuff, they miss out this part, and they always usually tend to, what they do is they tend to link the parietal straight away with the occipital, but what you need to be aware is that there is this blue part here as well. So we have the nuchal and superior nuchal lines, and you have the inferior nuchal lines. You have your protrusions here, external occipital. Then what you have is this part here known as the foramen magnum. So if I was to turn this slightly around and flip it around, so this is known as the fade the others. If I was to zoom in, what you have here, this whole here is known as the foramen magnum, and this is where your vertebrate, your atlas or your axis, first part of your vertebra connects to. So if I was to hide this and go in a bit more detail, so you can see these little bumps here, this is where your external occipital protrusions is, your superior nuchal line, then you've got your inferior nuchal line right here, and these two little bumps, like a little hollow hole, is what you can feel with the back of your head if you palpate around the back. And that's the key things that you want to know mainly from this whole lecture. Now, if I zoom back out and turn this skull around again, so you can see there's the occipital and everything. So a key part of the body which most people don't really recognize, it's this part here, which is known as the pterion, which I'm going to highlight with a pen. And this is this part here, which is known as a pterion. So a pterion is simply where four bones connect together. So you can see that the frontal bone here connects to it, the parietal, the sphenoid, as well as the temporal bone. And this is a really weak spot, and it's a really area of fracture. So if you've ever seen a James Bond movie, or if you've ever seen movies from other people, you know that when you get a gunshot to the head, or you put a bullet through your head, they usually aim it right at the pterion, because it's much easier. It's a very weak spot, and it basically collapses all four parts of the skull. So you've got the frontal, parietal, temporal, and the sphenoid, which form the skull collapses. Right. So just to go over the basics and to get a quick grip of what we've learned so far. So we have the frontal bone here, we have the nasal bones here, we have your vomer, as well as your ethmoid bone, which is formed from both the middle nasal conchae as well as the perpendicular plate. Then round the back, round the front, sorry, near your nose, we have your maxilla left and right, and this hole here is known as the infraorbital foramen. This here is the jaw, which we refer to as, or known as in medical terms, known as the mandible. What we have around here is the zygomatic bone, zygomatic arch, the temporal bone here. You have this part of the sphenoid bone that forms it. Then you've got the parietal, you've got the lamboid suture, you've got the occipital, you've got the occipital protuberance, superior nuchal line, inferior nuchal lines. You've got the coronal suture on top, you've got the sagittal suture on top, and you know, that's basically it for today's video. And I think tomorrow I'll be going in detail with the vertebra, the anatomy of the different types of vertebra and all the different parts. And once I finish with all the skeletal system, I'll move on to the anatomy of the muscles and of the skull, then the upper limb, and so on and so on. So in the next video, in this series of anatomy, is going to be the vertebral column, and then from there is going to be the upper limb, and then the lower limb, and the pelvis is going to have its own video because it's a really complex process and it differs between males and females. But apart from that, the skull is simply this. And I'd just like to say once again, thank you for watching this video. Hit this like button and please subscribe to my channel.